This conference will now be recorded.
All right, good afternoon, everyone. I think we'll go ahead and get started I know some folks will probably join, but we'll go ahead and get started with agenda and all of that. So thank you for being with us here today. It's hard to believe that here we are almost the end of November and headed into the holiday season. I know it's a busy time for everyone. We're just going to stay real focused on the updates that you need and that we need to make sure everybody knows. But we'll move through agenda pretty quickly as we can, and I think we should have time for questions as folks are able to stay. So welcome. Thank you all for being with us. I'm Denise Newneighbor. I am supporting Back at Home and DHHS with their rehousing efforts through Now the Redesign Collaborative. Also with me today, Adriana Diaz is with us from the NCCH Back at Home field support staff, and hopefully we'll be able to get through this quickly, and hopefully we have some good changes that'll help make your lives a little bit easier. If you haven't already added your name and agency to the roll call, just add that to the chat, and we use that for attendance. And I see at least we've got, I think, a couple of folks from the ESG office on the line as well. So I know we always have some ESG CV questions, so we're glad to have some backup from their office to answer those technical pieces. All right, Adriana, will you change the screen for me? Let's go ahead and go to the next one. Thank you. Okay. As always, we are going to start with our progress report. We'll pull up I've taken some snapshots from the dashboard as of today. Of course, this is a live dashboard as well that we'll drop the link in chat so you can take a look at that. We've got a few program guidance updates and reminders, just kind of a few logistics things around program. And then some updates on the assessment and referral system, some bigger pieces that are changing there, a reminder about the learning collaboratives, and then again, I think we should have plenty of time for questions and discussion. Let's go to the next slide. All right, so this is, you know what, I think I've left out the top line. As soon as I see this, I notice, you know what, Denise, you left out the top line one. So let me drop in the chat. Let's look at how many we've housed overall. I think I've just got the moved in months here. So if you click on the link that I just put in, this is the live dashboard that you can check anytime. It updates every hour. It's pulling up for me here. If you click on that link at the very top, you'll be able to see we are right at 799 households that have been stabilized in housing. That's a total of 1,588 people. That's 948 adults and 641 kids. So we are, we projected with everyone that sent in projections, we projected that we would be able to house about 1,800. So we're still a little bit under half of what we projected we'd be able to house. We actually are, we have many more enrolled than we've housed. So we currently have 1,502 households that are actually enrolled in Back at Home. So I know a lot of folks are, you've got a lot of folks in housing search and looking for units. We'll go back to the slide, and this one does show move-in over months. So you really see our peak number of households that we moved in per month there was in August. So we've seen some downward trends here in September, October. Please make sure that you're updating your smart sheet so we know that this is accurate information. We had thought that with eviction moratorium and things changing, I know many of you thought you'd be moving more folks into housing. So it could be that you haven't updated that information for us. Please make sure that you do. You also see that we do have some move-in data that's missing. So we had 117 where the date is still not recorded. So you want to make sure that when you're marking folks as moved in, that you're also filling out that move-in date that's in that RA section of Smartsheet. That'll make sure that all of our data here is correct. Let's go ahead and go to the next slide. Here we are with the leaderboard. This, again, if you go to that link that we put into the chat, you can hover over it to see the numbers. The gray bar represents your full projection, and the dark blue bar is how many households have moved in, and that lighter blue bar is how many have stabilized in place. So we've adjusted the look a little bit here with those projections, so you can, because I know we were all kind of comparing and seeing what other agencies were doing, but hopefully having that projection, knowing where you're comparing, is helpful there. Some folks we still don't have projections on. We hope that you're all participating in the learning collaboratives. We have some slides on that coming up if that doesn't sound familiar. We are working with agencies in there to talk through more projections, and the next call in that series, let's see, that'll be the Tuesday and Thursday after we come back from Thanksgiving. We're going to be looking at a template that will help you take the concepts that we've talked about in the last couple of weeks and fill that out and really get to a true projection there. So here we are, the leaderboard. I know a lot of you still making great progress of moving folks in, and some of you may need to adjust your projections if folks are staying for longer. These are all the things we've talked about in the Learning Collaborative. So if people, if you're paying more for each household, you may find that you can serve less households. If you need to adjust your projection, please just email that to backathome@ncch.org, and we'll get that adjusted for you. And I think in the upcoming, it's always so busy for your agencies right around the holidays. I know you're making a big push to get folks moved in by the holidays too. So if we don't have time to talk one-on-one before Christmas, let's make sure that we do in January that all of our adjustments look correct. Okay, let's move on to the next slide. This is how many are enrolled. So we have quite a number of households that are on our list. When you're on that live dashboard, as you go through it in Smartsheet, all of these you're able to hover over and see the numbers. We do have that just over 1,500 households enrolled. That represents that dark blue 32%. So you can see just how many names we have. We want to make sure that we're moving people either to enrolled or not enrolled. So we still have a really large number in that started. We have fewer and fewer in not started, which is a great thing. I think that's one of the things that we've been able to really change the inflow as we've paused 211 in so many counties. But we want to make sure that you're still moving folks through. We really want to shrink. We don't want to have green here. We want to have green as small as possible and really either move folks into enrolled to make sure that they're getting help, or that they're in not enrolled, that we know that we're not able to help them with this program, and hopefully we're connecting them with something else. So when we've talked some about this like restaurant analogy, that what we're doing here with enrollment is seating people in our restaurant, or making sure that they have a table to sit, but we know we've got to have staff that can come and take their order, that can come and really make sure that we get them assessed, enrolled, and ultimately moved into housing. So we know that there's a lot of things with that analogy that are go back to what we're doing in enrollment of. We've got to make sure we have staff time who can actually, we don't just want to put them at a table and tell them they'll be served and have them wait forever before their wait staff comes to take the order, right? So we want to make sure that of the 34%, really this 40%, that in some ways we've told them, yes, this is a place you might be able to get housing, or in our restaurant you might be able to get food. We want to make sure that we move them through the system, and we either are able to help them and get them into housing, or make sure that they know that they're not a household that's eligible for our program, or that we'll be able to help and help them kind of move on to the next best thing. So do please make sure that you're paying attention to your started and not started. On the next slide, I think there's a little bit more information about that. Let's see if it's the next one. This is the breakdown of all of our lists together. We have 309 that are in not started, and then you see this is really a breakdown of what you saw before. So the dark green is now that top just not started. The light green, 34%, are broken out here. These are all the households that are sitting in attempting to contact, that initial contact is complete, verifying eligibility, you're gathering documentation. These are all those categories that I just read through, the not started and the started. Those are the ones that we really need to move folks out of those categories. If you're looking at the live dashboard, you can scroll down towards the end of the page and it has every agency and a line there where it shows how many you have enrolled, how many you have started, not started. They kind of build on themselves. You'll see the 3 bar graphs together. Please make sure that you're moving folks out of these categories. If they're in attempting to contact, if you've tried 3 times to contact that agency, or I'm sorry, that household, go ahead and make that change that you've attempted 3 times. They should be moved to not enrolled, could not contact after 3 attempts. So I suspect there's a lot of folks still sitting in attempted to contact that either you have attempted 3 times and couldn't get them and just didn't update the status, or you haven't quite had the time to contact 3 times. Please go ahead, complete those 3 contacts and move them into not enrolled, could not contact after 3 attempts if you're not able to get them. If you're able to get in touch with them, that's great. You're going to start moving through that initial contact complete, verifying eligibility, gathering documentation. These are the ones that we also see households getting stuck in, that either you've lost contact with them, sometimes they're waiting on you, or sometimes you're waiting on them to bring in information. And you can move folks from that category, after 45 days, you can move them into that, let's see, it's a not enrolled one of not able to enroll. Make sure that I think on the next slide, we have that new one that we've added that detail. Let's go to the next slide. And this is a reminder. We had some trouble with my power going out right before the call. So I'm hoping I've got the latest version there on the server for Adriana to have. This is the live dashboard link. Let's see, Adriana, do you see a slide that talks about the not started? Is that on the next one?
Let me see.
Go one more for me and see if I've got it. Nope. All right. Well, I'm going to have to remember. Sorry about that, y'all. We'll go back to the go back to the live dashboard. Sorry for the technical piece. It really just I think they were only here for 10 minutes and my whole power cut out. So on the not started, you should be able to move folks. I'm sorry, in the started, we gave this guidance before. I'll make sure it goes out on Monday of all of the with all of the recap. So I don't just have to stumble it over here with no concrete reminder for me, but you'll remember from last month's meeting, we added it was like not started. I think it's not started or not enrolled, could not enroll for some reason. So make sure that you're moving folks again. Just the main point here is move folks out of that started or not started. And we want to have everybody either as enrolled or not enrolled. And in a couple of slides, you'll see why that's going to be even more important. So again, this just a reminder here, the live dashboard, hopefully you're looking at that kind of on your screen on the side. The data refreshes every hour, and this is a public link. So anybody that you share the link with will be able to see it too. Let's go to the next one. This is a new dashboard that we're sharing with everyone. This is one that NCCH data center staff, Andrea Carey, worked with ICA, the Institute for Community Alliances, which helps, as you all probably know, helps NCCH with HMIS work. So this one will be updated monthly. This one takes some time here to explore. I'm not going to, in the interest of time for everyone, I'm not going to walk you through it. I want you though to bookmark this, grab the link and bookmark it. It's really one that you have to spend some time kind of looking at. The main thing I want to tell you, if I was able to share my screen right now, what I would do is click on the screen and pay attention to on that upper right, it says filters, that you can filter basically anything on the page. So anything that you click on the page, you'll be able to it'll filter everything. So pull up that link that I just sent you, find your name on the left hand, your agency name. If you click on your agency name, everything on that sheet that you're seeing is going to filter down just to your agency. So there's a lot of different things you can do here. You'll see at the top, there's you can see we're on the financial tab. There's several different tabs to explore. Take some time to review this. If you want, if you have, as you go through it, if you have questions and you want to have a conversation about what you're seeing and maybe do some individual problem solving or some individual kind of questioning of what does this mean, email back@home@ncch.org, and either Andrea or I will set up a time to really talk with you about this. We'd love to get your feedback on it too. Hopefully it's a good tool to help you think more about how your program is operating. The source data on this is from HMIS. So if you are a VSP or a victim service provider agency, unfortunately, we don't have your data in this. It's only from HMIS at NCCH and NCHMIS. And then it also includes the financial data. So what they've done is they've matched the HMIS data with that financial data, of course, because in the HFA portal, it uses the client number. We're able to match the data here and really get a bigger view than we do normally. So again, only HMIS projects. And just an additional note, there are some agencies that started out as Back at Home agencies and their community is not currently participating in Back at Home. So we'll see some agencies on here like Good Shepherd Center, Housing for New Hope that aren't included in our overall dashboard, but are included here. So different snapshots of similar data. So spend some time looking at that. Let us know if it's helpful and what questions you have. Again, email back@home@ncch.org and we can set up a time to talk about it more. But wanted to make sure you knew that that is there. We'll start sending out updates to the list when it is updated on a monthly basis. This has all of October, it's up to date as of October. And so that'll be updated on a regular basis. Any questions before I move away from dashboards and progress, anybody have any questions on how we're getting any of the data, on any of the numbers that we're looking at? Do they seem right? Do they seem wrong? Any questions or discussion or comments from anyone? Feel free to unmute. I know that there's a little bit of a lag when you chat it in. Okay, so Mary says, after how many days do we change to not enrolled for some reason? Our main reason is already max caseload and can't enroll more yet. You know what? I'm going to try to pull up the slides because as much as I would like to remember the days that we decided, I know we had this conversation with everyone and we decided on a number of days, but I can't remember off the top of my head and I don't want to say wrong. So let me pull up last month's slides. And it sounds like, so you're at max caseload, can't enroll anymore. And Amy, you're saying really the same thing of your waiting. So Amy, yeah, so you're thinking we need a different, kind of in the queue, they would be eligible, we would enroll them if we had the staffing capacity. Did I get that right?
Yes, that's correct. I've been marking them as initial contact complete, and then under EN3, I think it is, I've been doing in progress. So that's just kind of my note to myself that they still are in need of help, but we just don't have the case manager capacity to take them on at this moment.
Okay. That's helpful. I think if that's obviously we're all using like the similar drop downs. If that's a common issue that you all need kind of like a ready to go in queue, we're not enrolling them because we don't yet have the staff to assign them. Is that something, will others chime in if you would also like kind of an additional enrollment status there to be able, I can add one. Amy, I can definitely add one for you all. Because you guys have such a large list to manage. But if others want that, okay, Sharon, we can do that. Okay. We've, on the Learning Collaborative calls, we talked about this really this week. We talked about this kind of crunch that we all face where you may have in your projection for the year, you still have slots available, or honestly, you probably still have funding available and funding to spend, but where that real bottleneck is do we have the staff time for it? Would you just quick chat in for me if you're in that position, if it's that you have the financing available and it's really just the staff time that you're feeling the crunch for? If that's the case, chat in, and that'll be helpful information for me to take back to Back at Home leadership. Let's see, let me pull up what we said last time. And I may have it here coming up in referrals. So the guidance we gave last time, and it may be coming up here in the slides and referrals, is within 90 days. So no one should be on your list for 90 days in the not enrolled, the not started or started. They should either be moved to enrolled or not enrolled within 90 days. So if you have them sitting, there for longer, it probably is really best to loop back to coordinated entry, have a conversation, see if there's another program that they can go to. And if they're ones that you've lost touch with, you're going to want to make, we're saying you can go ahead and move folks to not enrolled. Let's see, I'll pull that back up. There's a not enrolled could not verify eligibility. So if you get in that position where you could not verify eligibility, you'll want to use that within 90 days. Of course, I think everyone had a little bit of a different kind of time frame. Some of you are moving folks faster than that, not letting them have as much time for enrollment. I think that was okay. We just really set a max of within 90 days, they need to be moved off. So, but you're describing, I think you all were describing a different problem, which is that you can verify eligibility, but they are not yet, you don't have the staff to enroll them. And I guess, Amy, are you waiting to actually enroll and put them then in HMIS until you have staff time?
I'm not sure if my chat came through right away, but yes.
Okay.
So what I've been doing since our list is so extensive, I've been doing what we talked about a couple months ago when we were one-on-one about going through the entire list, seeing who is still in need of assistance, and then kind of updating our list from there. So I've been working on that actively. There's still a lot on there. But we just kind of have a lineup of waiting for case manager availability.
Okay. And for you all, I guess there's one kind of other conversation that's happening of trying to figure out how we can help with this issue. So I guess I want to run this past you all. Do we think that there are a group of people that are waiting for staff to be able to help them with housing navigation and such? But if we were able to figure out a way that they got financial assistance while waiting for staff, do we think that there's a group of people who honestly just like need the financial assistance and can locate units on their own? Are you seeing that happen at all? If we had something in the next 6 months that helps them do that, or is it really is like we have to just be able to surge staff and maximize staff in order to help households? Not sure how clear that was, but is there, I mean, we saw that in the hurricane, that there were a group of people that were able to, once they got approved for financial assistance, they were able to kind of locate their own unit and keep going. And I think this time we haven't been quite as, the money is different. So it's really been like waiting for staff to be able to then kind of approve and move you through housing navigation. Are there a group of people that could navigate on their own went ahead and had a way for them to get financial assistance. And I see, great. Okay. So that's kind of it looks like it's maybe a mix of, yes, most can navigate on their own, but only if there's available units. So if there's available units, they can do that. When there's not available units, that's a crunch for them and for you. Definitely a mix of folks who can navigate on their own and some who can't. A lot of units. Okay. Okay, that's really helpful. So in some of the conversations that I'm a part of, we're looking at not just ESG-CV. You all know that ESG-CV is going away sometime next year. Obviously the contracts only run through the end of June. So we're also looking at, there's several other pots of funding that came through recovery bills, and trying to think about how those could be used either to continue contracts with rehousing agencies or develop something flexible. So, but really helpful to know we're still facing the same barriers, which is, do we have enough staff to meet the need? And also, can we find the units to get folks into? If there are other things that you see as like I've in conversations with you all, those have been the two kind of consistent themes I've heard, is that like staffing capacity and also finding the units or just unit availability in general. If there's other things that you think like this is really a big piece, just chat it in, and really helpful for me to take that information to some of the folks that are looking at these other funding streams as well. Okay, so I think what we'll do is let's add something under the enrollment that is kind of like a in queue. I can see that you don't necessarily, if you don't have time to help a household, you're not necessarily enrolling them in the program. Let me work on that some more. I may follow up with some of you, and everyone can expect kind of an enrollment update in the next couple of weeks of something that we can have to kind of try to address those issues. Honestly, one of the things that I think is at least in the brainstorm is, can we enroll people? And I think some of you are doing this. Can we enroll them and say, like, you're qualified for this? If you can go find your housing, we will be able to help you pay for that. It might be a couple of weeks or a month before we have staff that can help you with housing navigation. I'm not going to tell you have to do that. I think that's really a program decision. There's a lot of pros and cons to that, but something to definitely think about. And it sounds like to me we don't necessarily have. If you were to do that, if you were to say, we're not going to assign you a housing navigation staff yet or a case manager yet, but you can start looking, I think you would want to go ahead and enroll them, so we know we have that clear start date. Anything else for folks? Yes.
This is Cicely with Southeastern Family Violence Center. I wanted to say this, that we're still trying to clean up Smartsheet, and we had like 384 people to go through 211. We're still getting referrals, and people are still turning in information. Let me say that. But what I'm finding now is we're turned off, and there are a lot of people that are staying on the streets that need to go through 211 and be able to be assisted. But at this time, we're trying to work through the ones that we have on 211 now.
Yeah, thank you for that. So we're going to come to, we are going to come back to, we have a section where we're going to talk about assessment and referral. So there's some things that I think we'll cover there, and you may have a decision to make of whether you want to reopen for 211 or not. But I think what we're also talking about, and what we've been talking about on the learning collaboratives as well, is that while we want to serve everyone, we also have to be very clear that we can't, and I think honestly we got ourselves into a little bit of a pickle in that we were adding more names to the list, without really an understanding of your ability of how quickly that would go. And I think in most cases it was working okay. And then all of a sudden, like we hit a month or two where it just like became an unmanageable list, and it was a little slow to turn. I mean, we did it very quickly. We decided in a week to pause 211. But it was, I think if I were to do it again, the lesson that I think that I would take from it is just to really make sure from the beginning, from application, that we have a projection, that we have an understanding of how many slots you can serve at a given time. We've been talking about this on the Learning Collaborative, but we talked, this week about the idea that each case manager should have a caseload, a target caseload for these programs for rapid rehousing that's between 20 and 25, one case manager to 20 to 25 households, in order to really make sure that you have the time to do what you need to with that household, to do housing navigation, to do the support services, to move to housing stability, closed cases, and all of that. I think that that's something that, moving forward, I would hope that we always use that kind of case per case manager, that caseload concept, and also for the whole agency of how many cases can you carry at a time. I think that's something, again, if you haven't joined into the Learning Collaborative, I hope that you will the week after Thanksgiving, so we can talk more about it. Hopefully that's a concept that will all, I think that many of you are doing that inside your agency. Some of you aren't. I've heard from some of you that you're not doing that. It's just like help as many people as we can. But the reality is we end up doing ourselves a disservice and the people we're helping a disservice when we just have these lists and caseloads that are growing and growing and growing. I know you guys are working so hard and have to be really tired. And I know that many of you are managers wanting to really support your staff as well. So hopefully we can really, in the new year, make sure that we're adjusting for caseloads. I don't have a great answer for, there's a lot more people who need the assistance than we can help, other than, my personal philosophy, which is to one household at a time, keep helping, concentrate on doing really well with, and getting that household what they need, while also thinking about program and how can everybody in our program and agency serve well, while also thinking about a much bigger picture with obviously we're kind of the bottom rung in a much bigger economic picture, and always wanting to work on those issues too. So again, really complex, and I think I want to say really directly, we do not expect any of you to solve for every case in the community, for every episode of homelessness or every family at risk. I think that is the overall system goal, that we get there. That's personally my belief of what our community should be able to achieve in our country. But we know that that dream is far from reality. And I hope that, keep chiming in with what you need. I do think that it's really helpful for me in conversations that I have with the state and with national partners of what the reality is and what you need. And let's keep advocating for more resources and training for staff. All right, I'll step off of my big picture, a little bit of a soapbox there, and really just recognize the hard work that you're doing, and let's take this as a lesson learned of really trying to get through these lists, right sizing the list, and from now on making sure that we don't design anything where you just are inundated with too many folks on the list. We know that those folks exist in the community. We don't want to ignore that, but we've got to get some more capacity in order to be able to serve these members. Let's move forward to the next slide. And I'm going to come back to thank you for all of your questions and comments here. Lots of more about units. I would really encourage folks. I'm going to make sure I will think about, I'm going to ask some of my partners, those state agencies that have other money, of how they want feedback and comments from you all, because I know one of the things that I enjoyed the most when I was at NCCH was really getting to hear from you all what you were seeing, what you think was needed, and using that to influence some of that state policy. So definitely keep having that conversation with us, with NCCH, but I'm gonna, I think the reality that you all are seeing on the ground with units is one that that I don't think all of us have quite understood quite how bad it is. And I think there is some money that will be used to develop additional units, but I know you guys are real creative, so I'll work some on that kind of feedback session and think about how we can get some of these to other folks that are in charge of other money, not just the money that we have and that the ESG office has, but really think about some development conversation too. Thank you all for all those comments. Okay, couple of updates here on the revised program. So one of the things we did in the Learning Collaborative was talk about your own program rules. And of course, as back at home, we need to update our rules or our program handbook. So you're going to see a new release of that coming next week. There's nothing in there that I really don't think there's nothing in there that we have not already covered on one of these calls or in some email or something. So it's just know that it's coming and it's in alignment. So the language is all updated, and so that that we're referencing the new forms and other changes that we've made along the way. So you'll see that come out next week. Just make sure that you bookmark the new one, or that you're always going through the Smartsheet portal to make sure that staff have the latest. Remember last month we talked about the transfer policy, we talked about the homeless prevention income research, and since the last time we met, the ESG office has some new housing stability forms that are out there for road testing. Those are forms 3.3 and 3.4, taking the place, I believe it's 3.8 and 8A, 3.8A. So hopefully you've tuned into their webinar on that. If you have any questions on those forms, as always, write the ESG office and you'll see that new handbook coming out next week. Let's go to the next slide. This is a reminder from our colleagues over at SocialServe, just a couple of things that they've seen starting to happen a few places. So just a reminder that all inspection requests, including those re-inspections, that they should all be coordinated through SocialServe. You don't want to go directly to the inspector. So in some cases, they already had you've already inspected the unit, have the contact of the inspector. It gets just a little mixed up with contract and all of those pieces. So we want all of that to go through the forms on the Back at Home CV resource portal. Again, all initial inspections and re-inspections are going through that portal. And we've had some folks requesting same day. We can't do same day inspections, but all are really happening. It seems like all of them are happening within 48 hours. If you're having problems beyond 48 hours, let us know. But it really, you really should see those happening in 48, but unfortunately can't do same day. And let's see, maybe the ESG office can chime in with Andy's question about if there's a link to that training video. And I do think that 48 hours is really the norm. If you have one that you've been waiting on, just go ahead and ping the colleagues at SocialServe and see what's happening with that. I think most of them, hopefully that's just one that you're waiting on. I'm not sure if there's some differences in geographic areas, but I do think that that it really should be within 40. Most of them are happening within 48 hours. Let's go to the next slide. I'm gonna make sure I'll get through these and have some time for questions. Okay, so sorry, we covered referrals a little bit, but a little more detailed here. And of course, I had my slides in the wrong place, so I got myself all confused. So here we are with the 211 referrals. You all know that starting in September, we started to pause some counties. Well, actually in September, we did an overall pause for the whole system. Previous to that, we had paused for some counties, but we did an overall pause. And since then, we have 23 counties that have come back online. We actually have some that have come back and gone back onto pause. The current snapshot is that we have 23 that are currently active and taking assessments from 211. We have 61 paused counties. So if you are currently active, I'm sorry, this should be, those are switched. If you are currently active, read the second one. If you need to pause referrals, email back at home. Currently active, but you need to go the other way to pause, email back at home. Are you currently paused, but you want to discuss reopening? If you're currently paused, but you think you're ready for some 211 referrals, or want those 211 referrals, email back at home at ncch.org. Each week, we make the decision for the upcoming week. So like this Friday, tomorrow, we're going to be deciding for Monday, November 22nd. So we roll that week by week. So if you're paused and you want to go active, email back at home. If you're active and you want to pause, email back at home. And 211 is under contract with DHHS until December 31st, 2021. There will not be an extended contract past December 31st for the type of real specific back at home assessment and referral. 211 doesn't go away. Of course, 211 stays and we'll be sending folks to coordinated entry, but we will not continue with 211 screening folks for back at home. So the next slide, we'll talk about what's happening currently and what's going to come up. You have always been able to refer folks through coordinated entry. Many of your communities have referred through coordinated entry. We saw many communities really just utilize the extra capacity through 211 for a time period. I think many of you now, since we've done the original pause, a lot of you are just doing referrals through coordinated entry and don't anticipate opening up for 211 referrals again. Again, these back at home, real specific referrals. Of course, 211 is always going to be sending folks to resources. Because we know 211 is going to be ramping down, and because we know more referrals are coming through coordinated entry, we took another pass at the assessment process. And honestly, originally it was really designed for 211 for that kind of call navigator and the household. So we've gone back through the assessment. Adriana has just finished up building that assessment on each coordinated entry sheet. So we've updated those on the sheets. We need to update some links. And so from now on, new referrals can come through coordinated entry on a new assessment. I think really starting Monday, you'll have that link for the new assessment. If you are a coordinated entry agency, hopefully this is going to be a lot easier for you to get those referrals onto Smartsheet. So this is, all referrals still have to go through so you can get that application number, get the household onto Smartsheet. It's just a lot less questions that you'll be keying in. And if you are not coordinated entry for your area, know that your coordinated entry will be getting this on Monday. They'll be able to start, at least it's basically the same process except for fewer questions. Because there's fewer questions, that means that there may be some blanks. When you're used to having information, there may be some blanks. That's information that we either thought didn't necessarily need to ask, it's already in HMIS, or really you're going to be asking that at enrollment. So once the 211 contract ends, this assessment or coordinated entry will be the only way that you'll be able to get those referrals from back at home. So it won't be coming through 211. Again, for the majority of our counties, this is already the way that you're functioning. The one big change that you're going to look for here in the instructions is that currently clients being referred to back at home are put in the back at home triage project in HMIS. We're going to stop doing that triage project, and we will start just putting them, there'll be folks going through CE, so they're going to be in the CE project. So over time, we're going to, I think NCCH or NCHMIS are going to close down that triage project. You'll just be working with households from the CE project in HMIS. And hopefully if you work in HMIS, that makes absolute sense for you. And if you're not in HMIS, you can rely on folks who are doing that workflow in HMIS to understand that for you. Again, that'll come out Monday, and we'll support. Again, hopefully it's all easier even this triage versus CE project should make workflows easier for CE. It's just, it'll be a little bit of a shift here. Let's move on to the next slide. Okay. So here's my slide that would have been helpful when we were talking about it earlier. So households should not get stuck in that not started or started categories. We've added, as of last month, we had added the not enrolled, could not verify eligibility. So don't have anyone in your list that is in the not started or started for more than 90 days. They should all be either enrolled or not enrolled within 90 days. This is a report that you can go to that should show your specific clients based on that EN1 enrollment status. If the referral was sent from more than 14 days ago, they're going to be showing up here. And I've also added the days so you can see how long they've been there for. So this is a quick report. Hopefully you guys used that from last month, that you're able to really look at, okay, who's been there for more than 90 days that I can move into this other category. And again, we'll look at, have some conversation around what kind of enrollment queue category we need to create to give you guys more control over your list. Let's go to the next slide. Okay. Anything before we just do this reminder about the learning collaboratives? Anything else on the enrollment or assessment you all want to cover? It's closing the person in the last column. Sharia, can you tell me, I don't have a large enough screen to pull it up right now. Is that last column, is it like, what does the language say on it? So recommended for closure is really, it's not one that is being pulled into the dashboard at all. Recommended for closure is there as a tool for you all to use. So you can use that in case conferencing, as a case manager. You know, in the learning collaboratives, we talked some about the checklist that Tom had of the kind of case review, where you can look at different indicators of housing stability health and decide, is this a case that looks like they're ready to close or not? And so we have that in the Smart Sheet as recommended for closure. Again, not pulling into any of the dashboards or reporting on it. It's for you all to use. So you could have your staff say, you know, update that if they went through that housing stability checklist and yes, it looks like they should be closed. You could update that to yes, and then they you as an agency can discuss that closure and decide, yes, it's time to close that case. So if the client was enrolled and now you know, so they were enrolled and you no longer have any contact with them. If you enrolled them, so if you actually enrolled them, at some point they were marked enrolled, that likely means you also have a project entry in HMIS. So what you will actually do is, if you had someone who was enrolled, you were working with them, after a period of time, you haven't heard from them and you're ready to exit them, it's really moving to exited. So under EN1, you would move them from back at home. I think it's enrolled, active, and back at home. You would change them to enrolled, exited from back at home. That way your numbers are going to match up with HMIS with OSMIUM. So if you've exited them, yes, if you've exited them in your HMIS comparable database, it's the same thing. So enrolled and exited. Great. Okay. Any other questions about enrollment, assessment, any of those pieces? I know that many of you are now our Balance of State, and Balance of State is receiving technical assistance from HUD around coordinated entry. And I know you all are really looking at, you know, what assessment would you move to away from the VI SPDAT. A lot of changes happening there. So this will be a change for back at home, that we don't have 211. It will really be up, moving forward, it will be up to the individual COCs of whether they'll use a call center like 211 or 211 or that type of thing. So want to make sure everybody understands where we're moving there. Okay. The this is a redo from slides from last month. Just again, we are in the middle of this new series of learning collaboratives. We've really been focused on program management, whereas before a lot of it was kind of that direct services with clients focused. We're really, I think it's been some good concepts we're talking about with program management. So if you're one of your program managers or supervisors or directors and you're not participating, we'd love for you to be able to participate. We've got this says last week, this is a redo. We've completed 3 sessions at this point. Let's go to the next slide. We have a couple of sessions left. We've done 3, the series of 3 here in projecting, budgeting, implementing progressive engagement and assistance. So we've got 1 more left on that, where we're going to be talking more about projections and caseload management. You will still have access to Smartsheet. When C enrolls in Smartsheet is not going to go away as long as Back at Home is here. Your client list of Smartsheet will be there. I'm sure at some point in the next spring we'll have to be talking about how do we evolve that. Do we close it? Do some of you want to keep it? Do you want to use it for other programs? Lots of conversation around that. Some of you are probably ready to get rid of it altogether, and Andy, I'm glad that you like it and it's helpful. So lots kind of changing here as we continue to go through. So the one more session on projecting and budgeting. Sorry, without other staff here, I'm like doing chat and talking, so it's getting confusing. Let's go to the next slide. I know that Andrea and Ashley are actually in a meeting for CE right now for Balance of State. We've got next week. The next session after Thanksgiving is on wrapping up that projecting, and then we'll have one more the week of the 14th. So either join us for the 14th or 16th, where we're going to be talking about staff onboarding and training. And so many of these things are really things that we're all having to do when we run in programs, when we're running our programs. So try to create a little bit of a collective here to learn from each other, and also so you don't have to do all that work on yourself. Sharia, yes, if you have your alerts set up for Smartsheet, that will continue. Smartsheet is going to, as far as the rehousing agency goes, Smartsheet, there's no change to Smartsheet other than you'll see some blanks, because when the CE does that assessment, there'll be some questions they're not asking, but otherwise nothing changing to Smartsheet on your end for rehousing agencies. I think that might just be the last update we have on these learning collaboratives. Any additional questions or feedback or anything you all need from us? Andy, glad that's helpful. I assume you're like keeping running notes in the Smartsheet then too. I think one of the things that I love about Smartsheet so much is it just is that kind of like easier functionality where you can see everyone at once and update them all at once. I know that's a lot faster than how many of the HMIS systems are set up, where you have to go into each individual case. So you can manually enter clients on Smartsheet. I would really recommend that if you're the CE agency doing that you're doing that on the CE sheet. Otherwise, you're not going to get the right app, the right application number. So the flow of it is they need to come through either the 211 sheet or the CE sheet, and then we get them moved over to the rehousing agency. So we've got a couple last updates to do. That'll happen over the weekend while you all are out of the sheets, and then we'll send an explainer out on Monday that will continue to do that. So if you are CE, if you're the CE lead, you'll want to make sure to look at, refresh yourself on that to make sure you're up to date with some of the changes. If you're a rehousing agency, if you have a client that you need to get onto your sheet, they should have come through 211 or CE. If for some reason they didn't, email Back at Home and let's get that sorted out. We've gone back and done a lot of kind of back data entry through CE to make sure you get those clients on there correctly. Any other questions or anything you got on your mind that is helpful for us to know as we have conversations about kind of where we're going next? So, Linda, great question there. So there's that you're seeing clients who get housed. So you're helping them get housed, you're paying a month's rent, and then they stop paying to gain eligibility for a HOPE program, which gives them multiple months. You know, it's interesting here because the HOPE program benefit, right? So in order to be eligible for HOPE, you have to be in a lease and have some trouble paying for that rent. I'm hearing from the HOPE program that they think that their funds will run out around the same time that our program does as well. So I see that you're saying trying to head it off by assuring that the clients that the financial assistance will be available. Of course, we're really balancing as a state, we want to spend all of ESGCV. We also want to help as many people as possible. I'm going to follow up with you, Linda, on that. And actually, if anyone else is seeing this happen, will you just chat in and I'll follow up with you all individually? Because we have been trying to figure out how can Back at Home and HOPE really partner. You know, at one point in time when we thought we weren't going to have enough money, we thought, let's get them housed through Back at Home and then we'll use HOPE to continue. We've just had enough money that and really are worried about spending to not be able to do that. So let's have some more conversation around that. Because I do think we're wanting to figure out how the two can be maximized and work together. And of course, the ERA money can also be used for some rehousing activities. Of course, we want to be able to get folks into housing and continue. Andy, I see the kind of reaction to HOPE ending. I really don't have, I need to be real careful here. Do not say, there is no date for the HOPE program ending. I've only heard some forecasts of how at the rate that they're spending. So, you know, there's possibility of other funding too. So I would not share beyond this call anything about any kind of projections about HOPE. Again, they are, you know, I think they're prepaying like in 3 months or 6 months. So, but it is a good, you know, it's for all of us who are outside of government and are advocating. It's a really good thing to make sure that we're talking to our state elected officials about, our federal elected officials, that we need to make sure we keep some of this rental assistance money. Again, that's another good plug for EHVs, for the emergency housing vouchers. As you see households, I know all households, it would be great if we could get them ongoing rental assistance, but I know that you're able to identify households that are some of the most vulnerable that are going to need that ongoing. Make sure you're in touch with your continuum of care and sending referrals to the EHV, the Emergency Housing Voucher Program, to keep that rental assistance ongoing. We're right at time. I'm glad to stay if there's any individual questions from folks. I'm going to make sure I go back. I was going through chats very quickly. I'm going to make sure I go back and read all of those. Thank you all for what you do every day. We'll let folks go, and a few of us will stay on the line in case there's any need for any more discussion. You know, I should say, I think the deadline for ERA funds, which is what the HOPE program is currently funded by, their spending deadline is, I believe it's the same as ESGCV, that's September 2022. So it's not necessarily a program that we expect to be around unless they find some additional funding sources. But the ERA funds, I believe, expire at that same time period of September 2022. Yeah, I see that additional comment, Andy. I'll give that feedback too. I think that there's it really is. This is the HOPE program and other rental assistance programs. It's actually programs we need all of the time. So hopefully some of those landlords will advocate with us to make sure that we can get funding to keep it around.